Hello everyone. So today's topic is intermediate uveitis. This is the uveitis which involves the inflammation of pars planitis, the adjacent peripheral retina, and the choroid and the vitreous base. Okay, and it is bilateral in 80% of cases, and it has equal incidence in males and females. And 85% of cases are idiopathic with association with HLA-DR2. Now, about the symptoms, we need to understand that most of the cases, if they have only intermediate uveitis, these will be asymptomatic. But in cases if these have an anterior spill of inflammation that leads to anterior uveitis, that will lead to pain, redness, and other symptoms. Otherwise, the mainly the intermediate uveitis is asymptomatic. The most common presentation is floaters. Floaters occur due to presence of vitreous cells and exudate within the vitreous. Uh, you may all you all may be familiar with the floaters. Okay, so we need to remember that floater is the main presenting symptoms in the case of only intermediate uveitis. The main thing we are going to study is the signs of intermediate uveitis. So this is a schematic diagram, and just for our understanding purpose, so there are five signs we need to remember. So these five signs are: there will be vitreous cells. Okay, vitreous cells in our vitreous. The second is the anterior vitreous will condense. Okay, so anterior vitreous will be condensed. Anterior vitreous condensation. The third and the most important and one of the most important feature is snowball opacity, or these snowball opacities are also known as ant sacs. Means these are small, you may see these are small snowball like opacities or ant eggs like opacities that are present near ora serrata. Okay, these opacities are present near ora serrata. These will be white in appearance. The next image we will see will make these all signs clear. Just remember these five signs right now: the vitreous cell, anterior vitreous condensation, snowball opacity. The fourth one being the deposition of fibrovascular plaque-like structure over the pars plana. So we see white fibrovascular plaque-like whitish grayish structure deposited over the pars plana, and this is what is the pathognomic feature of our intermediate uveitis, that is snow banking. Okay, and the fifth and the final feature is vitreous opacification. Though this is very rare feature that our vitreous has undergone opacification, and when we see through the pupil there may be leukocoria, so this is the rare one sign. So the five signs we studied were vitreous cells, the anterior vitreous condensation, the snowball opacities appearing over ora serrata, also known as ant sag, the pathognomic sign, the most important one, snow banking, and the fifth one, vitreous opacification leading to leukocoria. Now, this snow banking because may present with peripheral retinal periphlebitis due to adjacent retina getting inflamed along with the pars plana. Okay, so these are the five signs we need to remember. Now we will look over the image which will make all these things really very clear. So this is what you are seeing in the image: the vitreous cells, the pathognomic snow banking, the snowball opacities. You may see it. This will make the things really very clear. Okay, so this is what is intermediate uveitis. Now let's go on to its treatment. So while doing the treatment of intermediate uveitis, we follow Kaplan's protocol. It is a step ladder approach. Means when we are operating a case of intermediate uveitis, generally these cases have a good prognosis if treated well in time. So we will go for periocular and systemic steroid in our first step. Means we will give a subtenon injection of triamcinolone acetate, and if the patient responds well and good, but if the treatment fails, we will go for immunosuppressive drugs, and if this fails, we will go for cryotherapy or photocoagulation, and if this all fails, we will go for pars plana vitrectomy. Generally these cases are resolved with if treated on time, will be resolved with steroids. So this is what we need to know about intermediate uveitis. Let's revise these five signs again, once again: the vitreous cells, the anterior vitreous condensation, the snowball opacity, snow banking, in vitreous opacification leading to leukocoria. Thank you.